The Athena Foundation, actually led by Mr. Onyekachi, popularly known as Okeh, held a session yesterday, and the session was majorly about malnutrition in the East and the way forward. We had the governors of Niger State, the governor of Katsina State, the deputy governor of Kebbi State, the minister of agriculture was represented, and the minister of health was there himself. It was an eye-opening session, and I liked every bit of what I saw yesterday with respect to the quality of the deliberations and with respect to the commitment of the leaders to do what is in the interest of their people. I believe that with the quality of Okeh's engagement, he was definitely going to follow through with actions to get to actionable points on how to make the news better with respect to food production, with respect to security, and with respect to combating this monster called malnutrition that is killing our children. And it's not even as if it's affecting only the children, it's affecting pregnant mothers from this area. Unfortunately, that's our reality at this time, and it seems to be the new normal. But thank you to men like Mr. Okeh, who are already thinking and acting on behalf of the Nigerian people. Thank you so much. This brings me down to the Southeast. You know, I'm a regional government advocate. I'm an health insurance coverage for the entire Nigerians advocate. Some days ago, at the instance of Mr. Kenneth Okeh, who is the Chief Executive Officer at SynLab, I was able to attend a session where they were talking about the role of the private sector in health insurance and the rest of them for the Nigerian people. My people, I was blown off my feet when I heard what a state like Lagos is doing in terms of health insurance and the level they've gotten with respect to intentionally deepening penetration of their service, especially preventive care kind of service to their subscribers in Lagos. Anambra State in the Southeast seems to be interested and seems to be doing something quite remarkable with Anambra State Health Insurance Scheme. Now, a point of deviation. If you are based in Anambra, or you are from Anambra based overseas with your parents in Anambra or family relatives, I think one of the best things you can do for them is to subscribe to the Anambra State Health Insurance Agency services. After that subscription, you can be rest assured that you can call up on me if need be to assist you in case the quality of service you paid for is not being rendered to your people. I am doing that pro bono. It's a voluntary service and a community service I'm doing for the Southeast and I'm doing for Nigeria. So the aim is to drive this health insurance conversation so that the poorest of the poor will be able to access health care at a cost that will not choke them and that will not make them miserable. Now, down to the conversation. I'm from Abia State, which a whole lot of you, my audience, know. But I am worried that my state is yet to effectively key into this conversation. The conversation about healthcare insurance is very, very active in Anambra State. And I must commend both the state governor and Dr. Simeon Onyekachi for what they are doing. All the states in the Southeast, the truth, I've heard that Ebonyi is doing something, but I'm yet to get the deliverables with respect to that. Now, I want to ask my people from Abia State, I want to ask our dear governor, the Commissioner of Health I know was suspended or is going through investigations and the rest of them. Please, what is happening to healthcare insurance services in Abia State? The truth is this, times are hard and the cost of treatment is terrible at this time. We must look at how to activate this health insurance in the interest of the Abia people, in the interest of the Imo people, in the interest of the Enugu people, in the interest of the Ebonyi people. I mean, this has to be what it is across the states. We now have the National Health Insurance Act of 2022 that makes health insurance mandatory for every resident of the Nigerian states. So it is high time our state sat down, looked at our realities, and started investing in this project on behalf of every one of us. And that way also, the hospitals are going to benefit, the investors in the healthcare sectors are going to benefit. But before I also close, there is this adopt a primary healthcare facility project going on. Big men from various states are adopting health centers in their various communities and putting in as much as 100 million naira to support these health centers. If you are wealthy enough, I think this is the time to show why you are Nodogu. The truth is that the government owes us responsibility. You and I know that. But again, healthcare and security, from my own understanding of the studies I've done, cannot be left alone in the hands of government. So as an individual, as the young people whom by the grace of God has done of you, however it is, you can pull up funds and help support healthcare in your community. God bless every one of us.